Health experts are calling it a silent epidemic. Hepatitis C is killing more people now than AIDS, and according to the Center for Disease Control, baby boomers are especially at risk. One of every 33 baby boomers are living with the infection. Most don't even realize it. Now, Rich Arno was diagnosed back in 1999, years after he quit using drugs. He knows he got the infection from sharing needles.
At first, it was a little daunting, and then once I began to get accurate information, I realized that, it's not a death sentence, that a lot of people live out their lives with hepatitis C.
All it takes is a simple blood test to find out your status. If left untreated, hepatitis C can damage the liver so badly that a transplant is needed, and it can lead to death if it goes untreated. Joining me now is Dr. Assil Saleh with Foxhall Internists in Washington. She also holds a master's degree in public health. Thanks. Welcome back to the show.
Thank you very much, Tony. Great to be here.
There's a lot of information to get out, so let's jump right in. Hepatitis C. First of all, what is it? We hear a lot about hepatitis A and B. What's C?
C is another viral infection that can affect the liver. Hepatitis in general is inflammation of the liver, and it can be due to viral infections such as A, B, and C, or a number of other conditions. So C is one of those infections.
And hepatitis C, now we just heard that man's story. He got it by sharing needles, taking drugs. How else do people get it?
People can get it through a number of things, such as blood transfusions, particularly people who were transfused before July 1992, before we started screening for hepatitis C. Sharing razors, sharing toothbrushes, through injection drug use, which is a fairly large one. Actually, chronic hemodialysis as well, through that too.
Is it a sexually transmitted disease?
It can be sexually transmitted, although much less frequently than HIV, let's say. People who are at risk are people who have had multiple sexual partners or who are co-infected with HIV or another sexually transmitted disease, yes.
Now, the numbers we've been hearing lately is that millions of people have it and maybe half don't know.
That's exactly right.
Are there symptoms?
Unfortunately, with hepatitis C, acute infection is asymptomatic, meaning that people do not develop symptoms upon exposure. They live with the virus for years and years until signs and symptoms of liver damage occur, and that's when they present to their healthcare provider with symptoms such as nausea, fatigue, jaundice or yellowing, and liver cirrhosis, liver failure. As you mentioned previously, it's the leading cause of liver transplant and liver cancer, actually.
The headline this week that came out, baby boomers. They want all baby boomers to be tested. So if you were born from 1945, I think, to 1965, and I'm in that group, we should all be tested for this. Why are baby boomers at greater risk?
Well, there have been indiscretions, possibly in their lifestyle and so on, that may predispose them to this infection at that point during those times. What's important is to know that if screening can lead to prevention of death, that's very important. Screening can identify up to 800,000 new cases of hepatitis C, which, if treated promptly and effectively, can lead to a significant degree in reduction of death.
All right, now, again, I'm a baby boomer. I get regular physicals. Yes. Is this something that I may have been tested for already, or do you have to request this test?
Not likely, unless you've had risk factors such as, blood transfusion, or your healthcare worker or your doctor may have noted an elevation in your liver enzymes. It's unlikely that they've tested you. So it is a good idea to request that test. And as of now, the CDC has not changed their recommendations for screening. But we do recommend that people ask for that test. And
if you have the test, if you have it, how's it treated?
Usually with antiviral medications. The goal of the therapy is to reduce and effectively get rid of the virus from the bloodstream.
And does it, now you say effectively get rid of it.
Yes.
Does it just keep it at such a low level that it's no longer a factor?
It's actually, the idea is to get rid of it completely. And there have been new medications on the market that are very effective in curing the people from the infection.
All right, Dr. Assil Saleh, thank you once again for coming in. Great information. And I, like many others, I'm sure, will go get a test just to find out.
I think that's a good idea.
All right, we appreciate it. Allison, back to you.
The Fox 5 Weather app. Look 10 days ahead or hour by hour. View today's video forecast and radar that can pinpoint your neighborhood free at your App Store or Android Market.